Hello, everyone. So there's been quite a bit of talk about this idea of flattening the curve whenever we've been discussing COVID-19 and its progression. And you've probably seen this terminology or even the hashtag flatten the curve thrown about on social media. You've probably seen this in the news. You've seen it through governmental websites, etc. What I wanted to do today is to describe in a little bit more detail what this curve is and how this actually plays out using some real world examples. So at the time of this recording, there are about 329,000 cases of confirmed COVID-19 within the world. The last time I recorded a video on this subject, it was a little bit over a week ago, and there were about 127,000 cases at that time. So without a doubt, this number is increasing pretty significantly. Now, part of this is, of course, due to testing availability, and another portion is, of course, due to the virus just replicating as we'd expect. What I need to kind of add as a disclaimer here, when you see these numbers thrown about, remember that not all countries actually have the same practices when it comes to testing. So in South Korea, for example, they rolled out testing widely to their populace. So people that were symptomatic were getting tested very frequently. In contrast, China really restricted it to the most severe cases. So that's why their number's a little bit lower relative to their population. So these numbers aren't really representative of the virus that is out there that we haven't necessarily identified, because mild cases resemble a lot of other respiratory viral illnesses, as we've kind of discussed before. What I want to point out, though, is at the time of the last recording, there were just a few hundred cases that were identified in the United States, and since then we've actually shot to over 30,000 cases. So we are now the third largest place in the world for total numbers of COVID-19 cases. And this, of course, is in part due to testing, as I mentioned. But we also have several different focal sources of infection within the United States that have caused some of this widespread. So our current statistics in the U.S., we have just a little bit over 32,000 cases. At this time, only 414 deaths and 178 recoveries. So remember, the rest of the world, we have about a third of all of our cases that have resolved, meaning some people have gotten better, they've recovered, and other people have actually died in some cases. But if you look here and compare to the rest of the world, the United States is still very early in the management of COVID-19. So we have, just about 600 cases. That's nowhere near a third of all United States cases. We don't know what our outcomes will ultimately be. What we do know, however, is that our number of cases are exponentially increasing, as we would expect with this virus. And so what does this really mean in practicality? So how severe is COVID-19? Well, the mortality data so far ranges anywhere from about 1.5% all the way to 8%, as we've seen in Italy. And we'll talk a little bit about Italy later and what that actually may mean. But on average, the mortality rate tends to be about 2.3%. So we're seeing this mortality rate decrease a little bit as more of the cases are identified. What we do need to be concerned about, though, are the rates of hospitalization, which seem to be holding across most countries as this data is rolling in. So there are about 5% of all patients that are going to require an ICU bed, and about 14% just require hospitalization. So when we think about the limitations of our healthcare systems, these become very big concerns, and we're going to dive into that in a little bit more detail. So when we talk about the limitations of our healthcare system, that's where this whole idea of flattening the curve comes from. So we know if we do nothing to mitigate the spread of a virus that we've never encountered before, and it's a pandemic, we will rapidly overwhelm our resources. So if you look on this particular slide, you see a blue line at the bottom. It goes across there, and that represents the capacity of our healthcare system. And if in the event of an outbreak, a global pandemic, rapidly you'll see that healthcare system overwhelmed. And so what that means is everything above the line is a place where we really don't have options for a lot of patients. So when we talk about what to do, that's where this concept of flattening the curve comes in. And the idea is we decrease the rate of the infection in order to allow our healthcare system more time to respond, thus conserving more healthcare resources. And so this allows a little bit more flexibility where we're not having to boot other patients out of hospital beds that may also have very serious illnesses. And we're actually seeing the effects of this play out in real time in some other countries. So if you've been paying attention at all, you're very well aware that a lot of things have been done to flatten the curve. So in the United States, we've closed lots of schools and universities across state lines. We were worried about people coming back from spring break and the ramifications of what that might mean. We are already isolating patients who test positive to make sure they aren't exposing other individuals. We're recommending people self-quarantine if they start to exhibit signs and symptoms that are kind of COVID-like in nature. We're encouraging people to minimize their contact, their physical contact with other people, just to prevent that possibility of spread. And then a big thing that's been happening lately is the closure of non-essential businesses. Now, this is not unique to the United States. These things are actually going on in other countries like Italy, like China, like South Korea. A lot of these things have taken place. So the idea is those things provide a little bit more liberty to the citizens in a country. Where we start to get a little bit more, I guess, politically hot, we'll say, is when we start doing things like we've seen in Wuhan in China, where they had regulative curfews, where all borders were closed, travel was greatly restricted, and there were full lockdowns to the point where people really couldn't leave their apartments or their housing in some cases. In China, there were drones patrolling the streets. They were using facial recognition technology to encourage people or really force people to stay indoors. And so they were able to, as we've looked at the data, really dramatically impact the rate that this infection spread. So they capped it so it didn't completely overwhelm their healthcare system, at least to a staggering degree. So across the world, you're seeing a lot of these things instituted in various forms. But what does this actually mean? Well, there was a study that was it's pretty famous right now. It was done out of the Imperial College in London. It was published on March 16th. And what they did is they analyzed different countries and their critical care beds specifically, and they tried to look at it per capita, so per 100,000 of the population. And what you see here is the red line in this model, and that indicates the amount of surge capacity that they have, meaning extra beds in the ICU. And so if we do nothing, and these are actually models from the United States specifically here, if we do nothing, that's represented there by that black line, which is kind of like that big peak that we've seen. We've talked about that curve. But then they broke it down into what happens if we isolate cases, what happens if we have household quarantine, if we encourage social distancing, we close schools, etc. And you can see how those lines play out. So the chart here, chart B, is a zoomed in version of that same chart. And what I want to really contrast here are those areas that are above that healthcare surge line. So if you look really closely, you're going to see that the exposure where the healthcare system is overwhelmed between April of 2020 and August of 2020 is much more significant when we look at doing nothing. Now, if you look at isolating patients with the disease, quarantining folks, social distancing, that's represented by the orange line. And you can see that really it delays that place where we can't handle these surges of patients that are coming in. So we want to minimize that exposure above the line so we don't have to ration healthcare. So as we've seen COVID-19 spread across the world, one of the dramatic things that's really come to our attention is what's going on in Italy. So Italy at this point in time has the second largest number of cases in the world of COVID-19. But as you can clearly see from this chart, when we're looking at our growth rates, the United States is well on the way to beating Italy. Now, we do have a larger population than Italy. We have about 327 million people in the United States. So you're going to expect that to be bigger at some point. But at the same time, the rate of increase is very, very similar between the United States and Italy. And concerningly in Italy, they're at a point where their healthcare system is completely swamped. They are actually having to ration healthcare resources. There are examples of physicians, of nurses, of pharmacists, etc., talking about how they're not able to provide adequate care to their patients. They're having to choose who lives, who dies, who gets the hospital bed, who has to be sent home, who needs the ventilator, who doesn't get the ventilator. These are things that we don't want to happen. So in the United States right now, if you were to go to a healthcare system and you needed a hospital bed, you're going to get the hospital bed. It's pretty rare that you'll have to be transported somewhere else. So we have capacity to handle things. Well, what we don't want to get to is this point where we have no ability to handle our regular things that go on every year, or even these COVID-19 cases where we don't have a hospital bed to put some of these critically ill patients in. So a lot of horror stories coming out of Italy. And so the United States is being contrasted with Italy a lot. Now I got to be fair here. So Italy does have a different population than the United States. They have a greater degree of older patients than the United States, and as many people know, COVID-19 does indeed impact our older adults. But when we look at some of our data in the United States, the first 2,500 cases or so that the CDC have analyzed, they found that about 38% of all patients were under the age of 58 that ended up requiring a hospital admission. So our hospital resources, our healthcare resources, we really need to be conservative with. And that's why Italy's really in the spotlight right now. So let me give you an example of what this might look like in the United States. So as of the most recent data that's available, we know there are about 924,000 staffed hospital beds in the United States. So if you take that and you multiply it by the amount of days that you have in a leap year, so 366 days, we know that means we have about 338 million available hospital bed days, meaning there are hospital beds available each day. So it's a measurement of how much of that resource we have. That's how much we have available over a given year. So in 2019, we know that there were about 36 million hospital admissions, and the average time patients were in the hospital were about 4.5 days. So that means if we take some of that same logic, so there were 164 million hospital bed days out of that total value, that 338 million hospital bed days that were available, that were actually used just last year. So we're using just a little bit more than 50% of our total capacity in the United States. So we had about 170 million hospital bed days to spare. So what does this mean in relation to COVID-19? Now, all the data to date really indicates that about 40 to 70% of people in the United States may become infected. So these numbers are changing a little bit over time, but what I want to do is break down sort of a best case scenario if it is indeed just 40%. So I mentioned a little bit earlier, but we have about 327 million people in the United States. So kind of going off of that number, that means if we take 40% of that, we'd have 130.8 million that are infected in these best case projections. As we've kind of talked about before, between 15 and 20% require hospitalization. So if we go with 15%, so we're more conservative, that means 19.62 million people would need to be hospitalized in the best case scenario. So according to the data that we've seen related to COVID-19, durations of treatment for people who end up requiring hospitalization vary between 10 to 20 days, so it's somewhere in that range. So if we're really conservative and we say that the average patient is going to take 10 days, we know that to treat these 19.62 million people, each for 10 days, that would require 196 million hospital bed days. So let me break down what this means with some of the data we've talked about before. So we need 196 million hospital bed days to care for our COVID-19 patients that we're talking about. We know that we have 174 million hospital bed days based on some of what I've shown you from last year. So this is a rough estimate. So if you break this down into a percentage, what that means is we need to increase our hospital bed days, our healthcare system capacity, roughly speaking, by about 12.6% in order to manage these patients. Or in the worst case scenario, it plays out to be about 67%. So when we talk about that line that represents our healthcare resources, that's what we're really focusing on with this discussion, because it's really hard to move that line, especially to move it rapidly. But it's much more easy to slow down the rate that the infection spreads. So rather than spiking quickly, it spikes more slowly. And as a result, the healthcare system is less likely to be overwhelmed. So we, just in the United States, we are trying very hard to move this with all the social distancing and some of these other measures. But make no mistake, we're also focused on bumping that line up. So we're doing both of these things at the same time. So we're flattening the curve, but the term I like to use is we're also raising the bar. And how are we doing that? So there are lots and lots of examples, and I'm not going to detail these at length at this point in time. But one of the things that's recently happened is the president ended up deploying the Strategic National Stockpile. And so what kind of looks like that warehouse out of the Indiana Jones Raiders of the Lost Ark movie, this shot here actually represents a lot of our medical supplies that the United States actually has kind of tucked away for these emergent scenarios. So they have personal protective equipment, they have medical equipment like ventilators. I think they have about 12,000 ventilators. They have medications, etc. So they can push these out to states, to localities as they're needed. So this helps increase our healthcare resources that are available. A few other things that are happening. We know that personnel are limited, especially as people become more sick. So some of our healthcare regulations are starting to relax, and states are developing emergent provisions to allow healthcare providers to practice under some of these different cases. So we have more people available. We also have had some issues where people are hoarding things like medications, and so things like the state boards of pharmacy have been coming together to pass regulations to prevent people from doing those sorts of things. One other big thing that's been happening is there's been a lot of discussion around kind of pulling what we did in World War II within the United States and retooling factories to produce different types of things. So like personal protective equipment, like masks, doing things like getting volunteers to sew masks, as an example, is something that's been going on. So we're trying to ramp up our manufacturing. I believe I've heard of some car manufacturers trying to produce ventilators. That's another big thing that's happening right now. And then the last thing we're doing to raise that bar is we're trying to restructure our healthcare system. So giving you an example of my local healthcare system, we actually had a unit in our institution where we ended up converting that entire unit into a negative pressure environment, meaning all the air kind of gets sucked in, so none of the bacteria, or excuse me, none of the viruses can actually get out in this case. None of the COVID-19 can get out. So because of that, we've actually allocated special resources just to a surge of those patients. This is just one small example, and I'll tell you, as the days unfold, you're going to hear more and more and more about how healthcare systems are restructuring themselves to prepare for an influx of COVID-19 patients. So with that, I will end with my usual mantra. As we're going through the season, we're seeing lots and lots of news that may be scary, news that may be fake or exaggerated, and we're hearing lots of fears from our coworkers, our friends, or possibly even ourselves. So I want to encourage you to look at the facts and not focus on the fear. So it's all about facts and not fear. Maintain your awareness of what's going on. And don't be anxious with that. So distance yourself when you need to, but also don't bury your head in the sand. And then lastly, it's all about preparedness, not panic. So think ahead to prepare for what may come, not knowing that it will come. That way, when you're at that point, as I've said before, you can act instead of react. So that's all I have time for today. When we next talk, I'll actually try to talk about some more developments in the news and maybe even what healthcare systems are doing in greater detail. Thank you all.